Malcom Davies from Helen Joseph Hospital. He'll be here with us as we're trying to make sense and dissect everything, as we know that on the 2nd till the 6th of September, that's when we are celebrating and, commemorating, or rather, let me just say that we are building, trying to raise awareness when it comes to kidney health, and that's what we are going to be taking a look into. And it says that about 20,000 new patients requiring treatment every year, and about 10% of the global population is affected by chronic disease, and millions die each year because of they do not have access to affordable treatment on that. And that's what we're going to be talking about. So whatever question that, where do we stand? How do we do this? And Dr. Malcom Davies is the head of renal department at Helen Joseph Hospital. He's joining us tonight to shed some light and give us what is it that we need to understand about kidneys, and what is the science that we need to look into, especially when it comes to kidney disease. Doctor, good evening and welcome.
Good evening. Sorry, I'm having a bit of trouble with load shedding on my side, but very glad to be with you at long last.
Thank you so much. A challenge of a lot of us, and now we're seeing it being extended out throughout, the weekend. It's another challenge that we are facing in our country. I want us to get into, national kidney awareness, right? But before we can understand it, I think we should start at the point, what are our kidneys? What are the functions of the kidneys before we can, understand what may our kidneys be at risk of?
So
a lot of people have, you have talked about the importance of water, especially when it comes to, your kidneys. And what would be your take on the importance of, or let me just say, why is water important in order to help the kidneys do their function in our bodies?
So it's generally it's a misunderstood or a misapprehension that you can prevent kidney disease by drinking a lot of water. As I say, there are underlying disease processes that will make you at risk of kidney disease. There's also genetic factors that will increase your risk of having kidney disease. So risks that you inherit from your parents that you can't really do anything about. Now, it's true that if you are dehydrated for long periods, you can damage the kidneys, but that's really an extreme condition which almost never has a role in our kind of setting. And so, one should listen to one's body, and one should maintain hydration, especially if you're exercising. But it's also really important, in addition, as I say, to going for screening tests if you're within a risk group for kidney disease, to avoid drugs and other medications or toxins that can harm the kidney, which we call nephrotoxins. So beyond keeping yourself adequately hydrated, for example, it's important to avoid as much as possible drugs like anti-inflammatories that can damage the kidneys. Drugs of abuse, things like heroin, cocaine, for example, can also damage the kidneys. Generally, kind of living a healthy life, avoiding harmful toxins, is what you need to do to protect your kidneys. And as I say, going for screening if you're in a high-risk group.
What would be the do's and don'ts when it comes to kidney health?
Well, so as I think we said, generally a healthy lifestyle, so one where you are exercising so that you're avoiding obesity, which is a risk factor for kidney disease, where you're avoiding toxins, as we discussed, that can damage the kidney, and where you're kind of not smoking, which is also a risk factor for kidney disease, keeping a low, preferably low salt, low fat type diet, which are general sort of diets that are important for long-term health. Those will have a benefit on the kidney function. And as I say, the real problem with the kidney disease is that there's a limit to what you can do to prevent it if you're in a sort of high-risk group beyond living a healthy lifestyle. And that's why it's important that you are in that high risk, if you are in that high-risk groups, to go for screening to pick it up early.
Symptoms, these are the symptoms I have. What is the next step for me to do?
Well, so perhaps what I can explain is that there are different stages or severities of kidney disease. And as I said earlier, when you have these symptoms, it's often a marker of a very severe level of kidney disease, at which stage you may need a treatment like dialysis followed by a kidney transplant in order to deal with the underlying disease process. Our aim as nephrologists is to prevent patients from reaching that point. So we want to intervene before those symptoms onset in order to prevent the kidney disease from worsening over time to that level where you need dialysis. And the sorts of things which you can do in addition, as we've discussed, to a healthy, balanced lifestyle is really importantly control of blood pressure, control of sugar, reduction of your sodium or your salt in your diet in order to help control blood pressure. And if you are living with HIV, then obviously it's really important that we control the HIV disease with ARVs. And we also want to avoid nephrotoxins. So as we discussed, drugs that you can buy quite readily over the counter, like anti-inflammatory pain tablets, that can damage the kidney and accelerate the decline in kidney function over time. So again, the real key thing here is early diagnosis through screening in high-risk patients, and then we make interventions to control blood pressure and other risk factors and slow down disease progression over time. Now, there are other diseases where, for example, your body can attack its kidneys, which we call autoimmune diseases, which may require specific treatments to prevent further damage to the kidney in the form of drugs that we call immunosuppressants. But again, we need to pick that up, those diseases up, and that we can only do through screening and sometimes a kidney biopsy in order to determine what the underlying disease process is. So the answer to your question is generally a healthy lifestyle, control of risk factors for kidney disease like blood pressure and diabetes, and in certain people, specific interventions to target the underlying disease process. So we have at Helen Joseph outreach programs which take the understanding of kidney disease and how we can go about diagnosing it out into the community in order to improve, as we said before, screening programs so that we can pick up kidney disease early. In South Africa, one of the big limitations we have is we have really not enough kidney specialists to provide adequate treatment to everybody who needs it. So if you compare us to the rest of the continent, we have perhaps half the number of nephrologists per patient that they have on the rest of the continent. And our numbers are way below other countries of a similar kind of gross domestic product, so economic level. And so what this means is that we have to look at interventions which allow us to streamline how patients are diagnosed and make sure that they're picked up early and interventions are made, as I said, at an early stage, so that we don't reach a situation where we've got a large number of patients who need dialysis because we simply don't have the resources to look after those patients. So the goal of Kidney Disease Week is really to remind our South African populations that we really need to go and test for kidney disease through screening at our local clinic if we are in those high-risk groups that we mentioned before. So people living with high blood pressure, diabetes, HIV, or people who've got a strong family history of kidney disease where you know, for example, one of your relatives has developed kidney failure and needed dialysis. If you're in those sorts of groups, you need to go to your local clinic and let them do a blood test and a urine test and measure your blood pressure so that we can determine whether or not you have kidney disease, and then you can be referred on early so that we can prevent you needing dialysis.
Oh, thank you so much, Dr. Malcom Davies from Helen Joseph. Thank you so much for giving us sharing some light on kidney disease and how we should, protect ourselves and what are the signs that we should look out for. Thank you so much for your time.
Thank you so much for this opportunity to speak to everybody.
Do enjoy the rest of your evening, sir.
You too. Thanks.
Thank you so much.